Hello. So, welcome to this channel, Mental Health with Dr. N. I'm just going to be taking you on a journey, and I hope it will be an interesting one over the weeks and months, and who knows how long it's going to be on mental health. Now, just before we go on this journey, I need to let you know that the perspective really from which I'll be coming. And to let you know that I need to introduce myself now and what I do. By qualification and profession and career-wise, I am a psychiatrist. I have trained, being a psychiatrist implies that I have qualified first as a medical doctor, and then I went on to do my postgraduate training in psychiatry. In other words, I specialized in the diagnosis, treatment, and of course, management of mental disorders. Now, in terms of my background, I had my undergraduate medical training back in Nigeria, that's in Africa. And after that, I went on to some other parts of Nigeria as well. And then that's where I did my postgraduate training in psychiatry over a period of 6 years. And after that, I practiced in the same institution where I trained for a while at a senior level, working as a consultant psychiatrist in that place for about 4 years. After which I relocated to the United Kingdom, where I currently reside. In the United Kingdom, I have had experience in diverse areas of psychiatry, and currently I am going through my higher training, which is training at senior level in older adult psychiatry. Now, I have other interests besides psychiatry, of course, but these will probably be for some other day. Now, talking about this channel, I needed to give you a background, my background first, qualification, so that we have a perspective on some of the discourses we'll be having on this channel as we go along on this journey. The internet, I understand, is full of all manner of information these days. Anybody can access the internet, anybody can access YouTube and say all manner of things. And my thought is that if we as professionals leave some important aspects of our profession to the vacuum, that vacuum will sooner or later be filled by charlatans. And psychiatry is something that is quite dear to my heart. Mental health is quite something that is quite a passion for me, and especially considering my background and certain experiences I had in the environments in which I have lived and worked. I know that it is quite a very significant area of need. Information-wise, people need to be adequately informed about mental health, especially in third world countries. With my background of experience of having lived and worked across two great divides, a third world nation in sub-Saharan Africa, and then today in one of the developed nations of the world in Europe, I know that there could be quite significant divides in the way people think, in people's concept of mental disorders and how they handle it across this. So I will try to make this channel as much as possible useful to people of both divides and across different interest groups. But let me say from beginning that my focus will actually be on everyday people. My target is that the everyday person on the street should have an understanding of what mental disorders are, how they could identify them, and what they should do when they see that an individual or a family member or a neighbor, for example, appears to be suffering from a mental disorder. I'm not going to turn you into a psychiatrist. It's not going to happen on YouTube. But I just think that we should be able to identify these things, these conditions when we see them. And I also want to be mindful that as a psychiatrist, my perspective of mental health the focus might be a bit more a bit different to, for example, if somebody who's a psychologist or an occupational therapist or a social worker or is a mental health nurse who are other members of a professional team with which I work, if they were, for example, giving information on this channel, So I will make this as holistic as possible, all-encompassing as possible, attractive to people of different cultural divides, people of different intellectual levels, people of different literacy levels, and even I think that some professionals, especially professionals on this side of the divide. I mean, talking about Europe and America, for example, the more developed countries who have not been to or who have not had the privilege of practicing in sub-Saharan Africa or some other third world nations. I think you might find this channel also useful because I'll be discussing some perspectives of mental illness, some perspectives of psychiatry, from other from perspectives that you probably have only read about in books. As we go along, I will try to make uploads as regular as possible and as meaningful as possible. I welcome feedback from everyone, from professionals, from everyday people. I welcome questions, which I will try to answer as we go along. And I hope that you will find these meaningful. I will do my best not to make it boring, I promise. Thank you.